You're watching TVC News. As cases of COVID-19 continue to rise across the world, issues are cropping up. Perhaps the biggest challenge is yet is how the vaccines will get to the developed countries, as the richest nations have secured billions of doses, while others struggle to access supplies. While Nigeria is expecting its first shipment of the vaccines in this month, the Presidential Task Force on COVID-19 says a second lockdown could happen in specific states and local governments, given the increase in the number of cases. So I have joining me via Skype from Kano is public health specialist, Dr. Usman Bashir. Dr. Usman, thank you so much for joining us on TVC Breakfast. First and foremost,
thank you for having me.
Good. First and foremost, let us talk about this second wave, how much we have really tried to contain it. You know, the first time when the first wave broke, there was this noise everywhere in the news, do not do these, or the different protocol flying everywhere. Do not enter these, do not wear these, always wear your mask and all that. How much would you say we have tried in combating this second wave of the COVID-19 that seems to be very, very stronger than the first wave?
Good morning. As you have highlighted, since the initial vaccine, there have been situation, problem, logistical problems, and initially, the agency was expected. I remember in October, when the cases went down, we have been advocating, making, telling people that we are likely going to have this second because of the previous experience in the previous epidemics, like the Spanish flu, which also ravaged for 2 years. And now, even with this pandemic, we're in the second year, and all those ones were due to lack of compliance to the guidelines. That is, wearing of face masks, people gathering, and especially in December when people traveled, people refused to, even those that have been complying, they now felt that everything has gone, and then we are caught unawares again. And even up to now, people are speculating, people are not complying, and then the number of deaths are increasing. As you can see now, the deaths are increasing, and mostly from the vulnerable. And unfortunately, this second wave, even the youth are dying. Recently, we lost a doctor in Lagos, that 7-year-old doctor. So it's really appealing that we need to, and then the vaccines are not here yet. Other countries, if you look at the numbers, about 45 million doses have been given, but out of that, only 25 were given in low-income countries like Nigeria. So it's really something we need to ponder, and we need to really comply with those strict measures. I've seen that even the federal government wants to do a staggered lockdown, whereby some states that are showing large numbers may likely go into lockdown so as to contain the disease.
All right, Dr. Bashir. Dr. Bashir,
Yes.
We'll take these one after the other. But then another concept that is quite a bit troubling is the concept of the vaccine nationalism. You know, the big guys talk about the Britain, the France, Germany, etc. They're already entering pre-purchase of this vaccine, which might render some other countries, especially developing countries, you know, helpless in terms of getting access to this vaccine. Now, you know, the shortage of goods could lead to the making the less availability of these goods to be very expensive. What would you say, because the WHO has already warned some of this country not to, pre-purchase, to allow it to flow freely. Where would you say Africa is positioned in this regard?
As you can see, this is more of infrastructure and development, like you said, nationalism, developing our own system with our homegrown system. As you can see with India, they have their own homegrown system, and they are already having their own. So now there is demand, and it's like demand and supply. There's you need to satisfy your home base before you look outside. So that will also cause rise in price, and then we are poor nations. So really, we need to really develop our own homegrown, like our national research institutes. We need to develop them. We need to develop our manpower capacity. We need to revamp our facilities. And COVID is a call for all of us to look inward and develop our system. And we have to develop the national system. We have to develop the manpower. We need to revamp the infrastructure so that when we have events like this, we can have our own homegrown vaccine production system for anything, and our research institute, so that we will not be caught unawares. And as like I've told you, the numbers, they have already been 45 million have been given, and then in Nigeria we're expecting 100,000 doses of the vaccine very soon, out of 200 million we have. And I think they projected that we will get only 20 million this year, meaning that only 10% of the population will get. So you see now there is need for, and even if it comes, it's going to be prioritized. And then also we need to work on rumors and other things that are going around, because people are really skeptical on even taking vaccine. So we have a lot of work to do to enlighten the public on the need to understand these vaccines are safe, and they need it so that they will protect themselves and their families.
Okay, Dr. Bashir, you also raised concern about the issue of rumor, making the rounds concerning this vaccine. A lot of people have taken, a swipe at the NOA, saying that much has not been done. Then the information has not really trickled down to the, ordinary man on the street. What do you think we can do particularly? Because I know a lot of people are watching. So what would you think we can do particularly, apart from the fact that we're talking about these on our channels, the media also, making noise about this? What else do you think can be done to make people trust the vaccine production process, and also that could also, persuade them to taking this vaccine?
I think we have allowed social media to take over our campaign strategies, meaning that our enlightenment to the public. And the only way we can this thing is to use media like reputable media to inform people, keep people that this is safe. Not only that it's safe, several vaccines have been given. And then all those conspiracy things that are going around, they don't add up. Most of those things, when you look at them medically, they don't even make sense. So it's not feasible. And then when somebody wants to even attack you, these are not the ways to go about it. There are several ways somebody can cause havoc. You can put in the salt, things you use every day, sugar, and then anything you want. And even our phone that we're having now, we are being tracked, because most of the applications we have are tracking us. They know where we are, they know what we are saying, they can hear what we are saying. So there's no need for anybody to mix up with vaccine. And then, like I said, with numbers, even if the vaccine comes, it's not everybody will even get it. So it's a privilege for you to even have the vaccine, especially in our low-income country. So it's not even something that you need to start saying, I will not get. Even if they bring it, I will not. It's not something that is available at your doorstep. It's something that you need to put some effort to get it, or you need to be in a position that will make you at a vantage point, like maybe a healthcare worker, an elderly person, somebody with chronic illness. So those are the people that will even be prioritized. Even if it comes, there's going to be a priority. So people should need to understand that this is not something that will just be at your doorstep. It's something that needs to be rationed, especially in our part of the world. So we need to understand, NOA needs to step up the game. Our risk communication committees, pillars in the states and national level, need to also up their game so that they will inform the public on the appropriate message. And I can see now the appropriate information are now being passed, just like the way we're doing now.
Well, as a matter of fact, the tech giant Bill Gates has also tried to, refute most of these allegations against him, that he's also involved, he's complicit, etc., etc. I mean, coming back to Nigeria, the Presidential Task Force of COVID-19 says they're mulling second lockdown. You've also alluded to that. Do you think we can afford this time round?
Lockdown, the context of lockdown. We need to look at it in the context of safety first. Most of us were looking at it from the economic point of view. Lockdowns are meant to contain the disease, especially when you see these numbers that are coming out. You are seeing that from November to December, the numbers are 10 in tens and 20s. Now the numbers are million in thousands. And then if nothing is done, these numbers can go up to tens of thousands or hundreds of thousands. And that's what we're praying for. And then the only way we can contain this is to do what we are doing now. If people don't comply, that's why we're advocating people should comply. Even, so, the first wave is repeating itself, meaning that what happened if we have not learned our lessons from the first wave, meaning that now people are still not complying. And then in our major cities, you can see the numbers are coming up. Lagos, Abuja, and other states are bringing in large numbers. And then the only way we can, and then people are moving. There's movement, there's no restriction. People are not complying, they're not wearing face masks. They're not observing social distancing. They're not really, even the places that are provided the hand washing facilities, there's no water, or the sanitizer are finished. So really we need to, there might be stringent measures, and people need to be told that the next move of any government or healthcare that we need to protect this populace is to apply this lockdown. As you can see, so many countries have gone on lockdown. So there's nothing that can stop Nigerian government from implementing that if the numbers are not being abated.
Well, that has been said. But all the same, even though the federal government has said, okay, if you're not wearing your face mask, you might be arrested, you might be picked up by the police. If you're flouting the COVID-19 protocol, you might be picked up. If you're hosting a party, etc., you may be breaching the COVID-19 protocol. Just like we said earlier on, the first time, everyone seemed to be, compliant. But this second time, it's just like a lot of people are still with the notion that, come on, it's all a hoax. There's nothing like COVID-19. I don't even believe it. I mean, if you watch some of our reports lately, there are some people that are saying, I don't believe COVID-19 is anywhere. It's just, everything is just hoax. So how much do you think we need to do, or how much have we done? Just like I asked you earlier, and we drifted to another, point entirely. The protocol, the guidelines that are given by Nigerians, some of these public transports, they're now carrying full capacity. They're saying, okay, you have to come in if you're not paying, and you even pay high. So what should be done? If you're picked up, you might spend 6 months in prison, etc. You might pay certain amount of money. Are these things really effective? Are those who are to uphold these laws, doing the needful at the moment?
I think enforcement is one of the strategies, but in Nigeria, I don't think it will really work so much, because even if you arrest somebody, you might not afford even to pay for the fine, and then if you say you arrest everybody and put them in prison, you're causing more problem, because people might arrest somebody who is already infected and might go around spreading the disease in our prisons facilities. So really, I think we need to engage the public, and then we should look at what is happening, and then mostly we'll see people there, like I said, who are dying. So it's killing our elderly, it's killing our parents. Every day you open your social media or any radio, you hear death, people are dying. So we really need to understand this and even protect ourselves. So we need to engage the public. We are engaging them, we are telling them, and then like these measures, like I said, the lockdown, it's likely, it's not something that we want. But people need to understand that if they don't comply, if they don't wear their face mask, especially in public, and then they shouldn't, we should always look at it as, let me protect myself. Since this thing, people are not complying. let me protect myself. So it's all about our own personal commitment. We need to commit ourselves that we're going to do this, we're going to fight this disease and win this
Right.
fight.
Dr. Bashir, before I let you go, you're actually speaking from Kano State, and I understand that yesterday, I think we took this live of your state, Governor Umaru Ganduje, inaugurating the COVID-19 task force to drive home the information to people, to accepting, the dangers of this COVID-19 and to learn to live with it, peacefully, safely rather. How would you advise other states? What would you say about that? And then how would you advise other states to keen into this, this strategy of driving home this information?
I think it's a very good strategy, and within the past 2 weeks, I've seen that the government has engaged the relevant stakeholders, traditional institutions, religious bodies, various unions, and now I think they've launched almost 2,000 COVID-19 marshals who will go around, who are mostly environmental health workers, other enforcement agents, so that people will understand, at least they'll see people around them trying to tell them what to do. Like even in our hospitals, we do that. We don't allow people to enter our hospitals without face masks. When we see you around without face masks, we talk to you. So I think if other states will emulate what Kano State is doing, we'll go a long way in engaging the public one-on-one, meaning that it's not only we're speaking on radio or TV, and we're going to the street, making people comply, talking to them, so that at least people have seen that the government is employing people that will even do this, so that people will know that this is very important. So I think it's a very good move, and I hope other states will emulate what Kano State is doing, so that at least we can tame this tide and then control this before even winning the lockdown.
Well, all the same, just like you said earlier on, and I would just want you to also speak to this. We have the newly elected president of the United States of America, taking the vaccine on TV. The vice president, Kamala Harris, also taking the jab on TV, and so on and so forth. When ours arrive, the nation, who would you want to take it first, so that Nigerians will say, oh, this is not a lie, and I think I need to go for it, even though no matter how limited it's likely going to be, just 100,000 first that will be coming to the country. So who would you like to go first?
I think yes, like we can say, the president, because he's qualified, is above 50. So the vice president, all the political leaders are also, so there is need for them to, and they have already shown commitment. I think the governors forum have discussed that they will be the first to take the jab. So it's a welcome development. And like I said, healthcare workers, our frontline healthcare workers should be considered, because they are the people involved in managing these cases, and we've lost a lot of them. Recently, an NMA president said about almost 50 or so health workers died within 1 month. So I think we really need to consider the healthcare workers, the elderly, like I said, and then also those with background illnesses that will tip them out having severe illnesses. So I think, but I know, like I said, the number is so small, 100,000. So it's really not going to go around, but it's good for the leaders to show, to at least and it's not everywhere, not only in America, but there are several countries that I've seen their presidents usually take it. So, and right. I know I will also take it.
Well, Dr. Usman Bashir, public health specialist, thank you so much for speaking with TVC Breakfast. Thank you.
Thank you for having me.